being here and joining us. So thank you to everyone for joining us today. I realize you may not recognize my face, and that's okay. My name is Bonnie Bizzell, and I sit on the HealthAdvocateX board. I'm also the treasurer there. When I'm not donning my HealthAdvocateX cape, my day-to-day life is as assistant director for community for Honoring Choices Pacific Northwest, which is a philanthropic nonprofit joint initiative between the Washington State Hospital Association and the Washington State Medical Association. Before we dive in and I introduce Dale or reintroduce her to everyone, I just want to acknowledge that HealthAdvocateX is based primarily in Seattle, and Seattle sits on the traditional land of the first people of Seattle, the Duwamish people, past and present, and we want to honor with gratitude the land itself and the Duwamish tribe. So wherever you're joining from, I encourage you to just acknowledge and recognize the stewardship, the ongoing stewardship of Indigenous people. So with that, let me turn and introduce our main speaker today, our only speaker really. Dale Reisner is a doctor, and she's a HealthAdvocateX board member. She's the medical director of GYN Quality and Safety at Swedish Health Services. And today, you know, there's been a lot of things going on and a lot of changes going on, whether it's with vaccines or what we're seeing going on with the cases. And so we're going to spend the entire time today talking about the COVID-19 pandemic and providing updates and sort of threading out the different parts within it, including vaccinations and maybe variants and maybe some travel and what we're looking at there. So what I want to recommend is that if you have any questions, please put them into the chat box that you see at the bottom of your screen. I will do my best to make sure that we're elevating all of those questions so that we can get your questions answered. Rest assured, if for some reason we can't answer it and it looks like a good global question, we'll make sure that we follow up and that you can get that information. We'll follow up with an email. So with that, I'm going to turn it over to Dale so that she can go ahead and give us sort of the general overview and update about COVID-19 thus far. Dale?
Yes. Hi, everyone. And I imagine that many of you have met me before, but if not, I am on the board. And as Bonnie said, I'm a maternal fetal medicine doc by background, so that is high-risk pregnancies. But we, as part of that, learn a lot about general medicine and medical complications. And it's been incredibly interesting to be able to take my pregnancy view and look at women's health, which I also cover with the pandemic, and to learn how it's affecting everybody across the world at the same time. So if you've been on prior community conversations, you'll know that I often start with the cases, and I will do that just briefly. I give death rates, not that death is the only thing that we care about. We know that there are long-term complications with COVID for some subset of people, and we don't really understand why some get hit with these longer side effects or how long they're going to last. And so there is a lot of research we hope still going to happen with those long-term effects. But the death rate is what we see published and what we can track. We can also track hospitalizations. So if we look at where we are globally, there are over 136 million cases. So cases rely on being tested. So if we're not tested, there are probably way more than that. People that have had COVID but never went in and got tested, stayed at home, had mild illness, so on. And especially in the early days when we did not have enough testing capability, even to test people that were significantly symptomatic. The death rate in the world is around 4.8 million people. It's a huge hit. Within the US, we've had almost 31 million reported cases. And again, the same thing stands for that. I know that's underreporting. The death rate in the US, or the deaths reported, are 558, almost 559,000 deaths. The death rate in general is running around 1%. There are subset populations where it's much higher than that. So if you're in that, 70, 80-year-old, or you're immunocompromised, or some of those other factors, the death rates are higher. In Washington State, where we are, our case numbers are 378,000, and our death rate is a little over 5,000. Most of those happen in King County because that's our highest population. And we, across the country, and certainly in our state, we are seeing ethnic diversity strike again with higher caseloads, and for some populations, higher death rates. So for instance, in Washington State, our death rate in the Native population and in the African-American population are not higher. The case rates are, and hospitalizations may be, but in other parts of the country, there's significantly higher death rates in those populations that we know are not having equivalent health outcomes compared to people of Caucasian background or other ethnic or minority groups. So it's something to think about, because as you look at your own state, and certainly within Washington State, health equity is something that has been a significant concern about how we get vaccinated. So we'll talk about that a little bit, as Bonnie mentioned. Before we talk about vaccines, and I think we'll spend a fair amount of time talking about vaccination, a lot of different components that go into that. But I do want to highlight that across the entire country, we are seeing increasing cases recently. And it is being called the fourth surge. And to put it into perspective, it is not as high as what we saw, in November, December, January with the holidays. But it's pretty comparable if you look at the peaks to what we were seeing in July after the 4th of July, so July and August, which is higher than our initial infection rates were in the spring. Now, again, when it first hit, we certainly had far less testing capability, so it's not clear if there's a little bit of obscuring of actual data from the initial peak of infections. So I just want to highlight that the groups that seem to be having higher rates of infection are young adults. We're seeing more mild infections in children, but cases in children who have the ability then to pass it on to other family members. And the 18 to 20s and 30s to 40s seem to be the groups that are seeing more cases currently. We have had higher rates of hospitalizations. Our death rates seem to be better, but that may be in fact because our 65 and above groups are showing less cases. And this may be a result of both being really serious about precautions and also, the first group to get vaccinated. And we started in Washington State, we started vaccinating in mid-December. So we should be seeing protection in that age group when we have focused on the highest risk first and working our way down. And then in every state, it's a little bit different, but it's pretty close across the country that by this week, if it hasn't happened already, by the end of this week, everybody over 16 or 18 is going to be eligible to get a vaccination. And the biggest thing that's going to frustrate the heck out of people who want to be vaccinated is that there's not going to be enough product. So just know that it's already been an issue for the more vulnerable folks. And so I might even stop right there and just see if there's any questions about that piece before we move on to more about the vaccinations.
Well, most of the questions are actually around the vaccinations, but I think it's important to sort of elevate this. I don't know if we want to call it a trend, but the fact that those who are getting infected nowadays tend to be younger. And there's a multitude of reasons of why that could be, from spring break to not being eligible for the vaccine. And, you know, I think it just sort of brings to mind that, you know, we're not out of this yet, and that we need to continue really being proactive, not only to protect ourselves, but others. So I'm thinking that it might make sense to go ahead and start talking about vaccines, since a lot of people are very.
And then we'll see if I don't touch on what your question is. I'm happy to.
We're getting some really great detailed questions. So why don't you just go ahead and give us an overview about, you know, this, because I heard, you know, you just said that there's a sometimes in some places there's this lack of availability, and then also sometimes there's like excess too, I've noticed.
Right.
And so can you just tell me what you're seeing about, you know, delivery and people being able to get it, and sort of any other overview about vaccines that you think is really important information?
Sure. So vaccines are, the actual vaccine product are distributed to the different states. There's been a huge push with the current administration to get more vaccine out everywhere. And so that is awesome. But it's still, you know, we were sort of behind the 8 ball with not having purchased enough in the first place. So you have to kind of pre-order because the whole world wants vaccine as well. And so I can use, you know, Washington State as an example, that we have not had enough. We had great initial start, and then we have not had enough to really supply everybody everywhere that was in the, say, over 65 but nothing else going on range. You know, as we have broadened our ability to get an appointment for a vaccination, we've had obviously a lot more people who want one, and so having the supplies is super important. And you will see that across the entire country. There have been big efforts to get things into more rural counties. And for instance, what I just heard this morning, Thurston County has an excess. So if you live anywhere close to Thurston County and you're in Washington State today, they have open slots that didn't get filled. And so I think we're going to see a little bit of that. Now they're also within each state, to varying degrees. There is huge public health communication and hospital-wide communication. The Washington State Hospital Association and Department of Health have worked together very closely to make sure if there is excess vaccine, you know, as the day goes along, someplace that it gets shifted to the places that can get it out into the community quickly, so we're not wasting anything. And so that's really important. So occasionally something will pop up. What we have switched to, and I think this is the case across the country, it's what I've been hearing, is Vaccine Finder instead of Phase Finder. So whatever your state is, look for Vaccine Finder, because that's how you're going to be able to get your appointment. And then if you do have an appointment and something opens up in your neighborhood and you can go get your vaccine sooner, make sure you cancel your appointment so someone else can have that slot. Really, really important. And the other thing is that if you're getting Moderna or you're getting Pfizer, you need 2 separate vaccinations. And you will have a vaccination card, and you must bring your card with you So this is a good time to kind of
Yeah.
remind folks that if it's Johnson & Johnson, it's a single shot and you've got one card and you keep that card, please, if you know anyone getting vaccinations and they're excited about it, share. Don't take a picture and put it on social media. It's got your full birth date and name on the front of it, and you're going to potentially open yourself to some significant harm with people trying to take advantage of the pandemic. And if you want to laminate your card to keep it, that's not a bad idea, but wait till you get your second shot before you laminate it, because once it's laminated, they can't enter on the back side, and it has to be signed off. There's a lot number so they can track it. So really important. They're small things, but they're really important things. Tuck it away in someplace safe, and then make sure that you bring it if you're getting a second vaccination.
So can we
Yeah.
real quickly talk about, there's been several questions around sort of the safety and the data around the vaccines, including, getting COVID after getting vaccinated, or, what are some of the adverse side effects to getting the vaccine, all the way to like, what about if you're asymptomatic after you've been fully vaccinated? Can you still transmit COVID?
Right.
So those are just 3 things. I don't mean to throw them all at you at once, and I'll be here to help remind.
Sure.
But can you start talking about the safety around it and what it means not only for the person, but the people that they may come in contact with?
Exactly. So the vaccines that we have in this country, the 3 common ones I've mentioned, Johnson & Johnson, the single one, Pfizer, which was the first out, Moderna, the second out shortly after, all appear very, very safe. There's been some swirl around AstraZeneca, which we don't have distributed in our country, about clotting complications, blood clot complications. And there seems to be some truth to that, to very small population. It seemed to only affect certain age groups. So we're not going to go into that. Much more needs to be studied, because what we didn't know about those patients was whether they had underlying risk factors for forming blood clots. And so you may have heard that Europe decided to put a hold on that particular, parts of Europe put a hold on that vaccine, and most of them have opened right back up again, and they're using it for younger, way younger people or older people, but not this sort of, I think, 50 age group, and it seemed to be in women. So again, it makes me think that there might be some other risk factors that haven't been uncovered since it was a specific population. Otherwise, the vaccinations we have in this country, the vaccine tracker that the CDC is doing is keeping track of all of these vaccinations. And
is there, let me ask real quick.
Yeah.
Is there a central location where people are logging the vaccinations, or
so the state keeps track for your medical records perspective. Like the state keeps track of all vaccinations. So whether it's hepatitis or whatever it is.
Thank you very much.
But also you have the ability to do this vaccine tracker that goes directly to the CDC, and they check in with you when the day you get the next day you get your vaccine, and they track you for a few weeks. And then I was vaccinated in December and January, and they're still checking in with me once a month to make sure that I'm okay, not having any long-term complications. And that now has millions of people in it, and really nothing that is jumping out. In fact, the anaphylaxis, or the extreme reaction to vaccine, is probably lower than any other medication we know of from what we've seen. There are very, very few people that cannot get the vaccine if they want it. There are very few reasons that you would be told you're not eligible. So cancer patients, all kinds of patients. Now you got to wonder whether your chemotherapy or things like that, that's something you would take on. And especially if advocates are working with cancer patients, I would rely on what the provider is recommending.
Yep.
But, and we do, when we're working in a vaccination clinic, we'll talk a little bit before the end of this, because I'd like to reach out to Beth, at least, who's also on the board, who's volunteered, as I have. And, you ask if they've had another vaccination within 2 weeks, you ask if they've, got a recent illness, and you run through all the COVID symptoms before you give them the vaccination. So really quite safe and effective. So I want to talk a little bit about that, because I know people are worried about it. So if you're getting any vaccination that is a 2-phase vaccination, you get some immunity within 2 weeks after the first, but you don't get full immunity till 2 weeks after your second injection.
Okay.
Johnson & Johnson is going to be about 2 weeks after your one injection.
Yeah.
And so you need to take all the same precautions that you would for that, for the fact that we're in a pandemic, while you're in the process of that vaccine to at least 2 weeks or 6 weeks after or 8 weeks after, depending on which of the 2-part vaccinations you get. It does not appear that one is better than the other. The overall preventability rate of Pfizer and Moderna is almost exactly the same. It's in the upper 90s. Like, we've never had a vaccine that was that effective. This is against the initial COVID-19 virus that we saw. The Johnson & Johnson was not as high, was I think around 70%, but is equally effective at preventing serious illness, hospitalization, and death. So that's really what we care the most about. That's what we hope to get out of a flu vaccine, So I just want people to, if you're offered Johnson & Johnson, take it. If you're offered anything, take it. unless you're really not wanting a vaccination at all, then don't take a vaccination. But otherwise, take the first one you're offered. And there may be, so sometimes Johnson & Johnson is going into rural communities because it doesn't need quite as much storage protection as the other two. And we're starting to see local pharmacies offer it. We're seeing it in schools and churches and public health departments and community centers. And now we've got mass vaccination sites as well. So lots of places. Yeah.
And I think, I was telling you earlier that I love the idea of getting vaccinated, and then 2 weeks later, being able to do more things. And
so I want to talk about what the more things are.
Yeah. Well,
So,
by more things, I mean, we're still being masked, but maybe more comfortable.
So I'm gonna run through, because since you brought that up, I'll run through the things and this is really, if you want up-to-date stuff, check with the CDC. It's really got a huge focus on vaccination now. And so it will be answering questions that we don't know about the pediatric population and the pregnancy population as well as we do about the rest of the adult population. But let me talk about those after I say what their recommendations. And actually, this is totally consistent with our local public health folks. So if you are 2 weeks after you're fully vaccinated, whichever one you get, you should still not visit indoors without a mask with people who are at increased risk for severe illness. Okay, so if you are working, if you're an advocate, or if you have a family member that's at increased risk, then we should not go there without a mask. Okay. If you're outdoors, different story. And we should also avoid medium or large gatherings, particularly indoors. So what they do say is you can visit inside a home or private setting without a mask with other fully vaccinated people of any age, right? So if I ever get across the border to Canada again and I get to go visit my aunt, I'm fully vaccinated, she's fully vaccinated, we could actually see each other face to face in person. You can visit inside a home or private setting without a mask with one single household with unvaccinated people. So those people you would want to not be at risk for severe illness. So if you, like me, are a little bit older, my family members are not all vaccinated, although they're getting there pretty quickly, then I visit with them because they are not at risk of severe illness, and they're a small unit that I know where they go. You can travel domestically without pre or post travel test, and there may be some travel questions coming up.
Yes.
You can travel domestically without quarantining after travel.
Okay.
Domestically, okay.
Yes, I just read today that Prince Harry flew back and he was quarantining in the UK. So internationally, you still have to quarantine.
Yes. So if you travel internationally, you need to go by what countries are saying, and anticipate that you don't need a pre-travel test depending on the destination. So you really need to look into where you're going first to see, because some places are requiring that and some are not. And you can travel internationally without quarantining after travel in most places. But again, you have to be sure, because like Canada is still requiring it. So, until they loosen up, they've done a really good job on the West Coast of limiting infections, and they're not trying to not take any chances. So that's that 2 weeks after your completed vaccine. Those are the things. And you want to make sure that you know these things about vaccinations. So we still need to protect ourselves in crowded places. And the question about variants is going to come up if it hasn't already. There are variants that we know about. These viruses will continue to mutate. They do that on a regular basis. And the majority of the variants that have been studied so far, the vaccinations that we have in our country are protecting against severe illness and death. Okay. Let's see, I jotted down the limitations.
Well, and I think that's an important reminder. I think with any vaccine, we need to remember it doesn't necessarily prevent it 100%, but what it does is it mitigates the impact, hopefully, and so that's a really important point. Continue, please.
Yeah. So what we do know about these variants is they are more contagious. And the other thing is that our traditional tests for COVID-19, the COVID-2 that originally came out, may miss them. So if you have symptoms, you could have, even if they're mild, you could have picked up one of these variants. And you personally will not get as sick, but you could transmit it. And if you go in and get tested, it may or may not be helpful. If it's a positive test, it's a positive test. But if it's a negative, it may not be helpful. And the other thing there's a lot of confusion about testing right now. Another thing to warn people about is that we are a little bit confused about when we are exposed and whether we get tested and when we get tested. So if somebody shows up in your workplace who's ill, then you need to go home. And depending on when they had their symptoms, if you've been around them quite a bit, especially if you have been not wearing masks. And just as a side, I know of a recent young meaning in their early 40s, late 30s, family member who at work, they were not wearing masks necessarily. And the owner of the company doesn't necessarily believe in it. And somebody was sick and then somebody else was sick. And then, people are coming back to work. They're doing a quick test. It's negative and they're coming back to work thinking they're fine, not wearing a mask again. So you have to protect yourself and you have to warn your clients that if somebody's sick and in the workplace environment, or if you hear about it, you were just at the beauty parlor and somebody's sick, you need to give it a few days from that exposure before you get tested, because if you've just picked it up, your test won't be positive no matter what. And then you don't have to do a long quarantine like we were doing before, but you still need to think about whether you could have picked something up and whether you can pass it along to somebody else. I think that's super important.
So I want to go back to the variants just real briefly. Do we know why these variants are more transmissible, or why we don't know?
No, they just, they adapt because they're like, okay, this human's a good place for me to hang out in. And, oh, well, now there's something that's in the way. So I'll just change something. And, we all do that. We don't tend to adapt as quickly as the viruses do. That's the problem.
I certainly don't. I certainly don't.
Some of us are not early adopters. So yeah, just think of them as early adopters and that might explain it. So they will continue to try to make the best home for themselves. That's what they do. Yeah.
Well, yeah. And I think it's really, I had not heard that the variants may not be picked up by the testing. And so I think that's a critical piece for anybody advocating or working with anybody actually to understand so that they can take the protective measures.
And just an emphasis on it may not prevent you getting infected. It should still prevent you from severe disease, even with the variants. That's what we know so far. So again, I would check in once a month, maybe with the CDC to see if there's new information. I do want to highlight that there's a lot of questions in the pregnant population. Or initially, World Health Organization said, don't vaccinate pregnant women. There's no data, and the CDC said the same. But in fact, there was a big pushback from the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine saying, this makes no sense. When we looked at the data from 2020 for our pregnant women, they get sicker. There was more risk of ICU admission. There may be slightly higher risk of death if you are pregnant when you get COVID. So why would we not vaccinate? There's nothing in these vaccines that suggests that it's a problem for pregnancy. It's also been looked at in animal studies for fertility, and there doesn't seem to be any fertility risk. And so we within the OB community did not follow that don't vaccinate. We have really used patient decision-making with the provider and the patient and having it be individualized. But now we're really having a bigger push for vaccines.
So do we know when pregnant people, should get vaccinated?
Well, our typical thing for it's not a live virus, so it probably could be anytime. I typically practically say, I'd say from a practical perspective, probably get through the first trimester. If there's always we see with viruses and vaccines and medications, if there's a baby's got a birth defect, did you take something or were you exposed to something? So it would just avoid that because we don't have a lot of data. We do have some first trimester experience with people that were, vaccinated or got the wild virus early in pregnancy, but it's not enough to say 100% safe. So I would just say, if you have the option, get it later. The other question that comes up around pregnancy is breastfeeding. And yes, we encourage you to get your vaccination. There have been studies looking at breast milk and there's natural passage with the antibodies like we see with any other either vaccination or wild illness, that if the mom forms antibodies that comes across in the breast milk. So it will protect your baby without the baby needing vaccination if you've had a vaccine during pregnancy or close to delivery.
So I want to go back to this idea of getting a lot of people vaccinated. And once the door opens up, you know, we might have more demand than supply. We're already seeing that in some places. And I want to go back to something you hinted at or you alluded to, is this idea of needing help, helping people get vaccinated and volunteering. And I want to thread that in. Can you talk about the volunteer opportunities, and can I lean to Beth to talk also about her experience in being the volunteer? So we'll start with Dale, sort of outlining what you could do to help other people get vaccinated. It's a very powerful thing to help people get something that they really want. And then Beth, could you follow up with just sort of telling your own story?
Yeah, and well, I don't know, maybe Beth tells her story first, and we
Okay, that's a great idea.
I think that's great. You
Beth, tell us your story about how you volunteered.
It's not a big story. I volunteered at Swedish initially, and they were doing large volumes, and they wanted me because I was a nurse. But what I found is it's not just giving the vaccine, it's an entire logistics model. So you might volunteer and be herding people into lines. You might volunteer and be helping people in wheelchairs access, the vaccinator. So I would encourage anybody who has 2 feet and 2 hands who cares about this. It's not about being a nurse. There are plenty of people who can give a shot, but there's a lot of roles that are really important. And the other role that I also volunteered in Wyoming while I was there this winter. And Wyoming is a very conservative state, and there were a lot of people who were concerned about the V-Safe and that the government was tracking them and that it was, they're going to follow me. And so I was able to do a lot of education and actually got them to put up a educational video while people were sitting there for their 15 minutes. So there's a ton of ways and opportunities to volunteer. And I think with these new huge, trying to vaccinate really large volumes, they need, somebody asked the question, is it just product? No, they need a lot of people because volunteers typically don't work 40 hours a week, but they're trying to vaccinate all the time. And so even if you can do a day or half a day, it's really helpful. And we can, I know Kristen she's not on, but had some resources for even how people can find rides, because Uber is now helping, and there's Catholic Community Services that's helping if people can't get to the vaccine. In Wyoming, we had this great mobile unit that was going out to nursing homes, and that's a great idea. But when you're doing this many vaccines, you can't have refrigeration for 2,000 vaccines, so on a mobile unit. Anyway, and the other thing is, I think that really, really emphasizing this card, it seems like such a little thing, but that card may someday be our ticket to go places. So I would make sure and keep it handy, and make sure mine's in my passport. I'm keeping it there because that's
and some, I think some people have heard that maybe they shouldn't laminate it. And my understanding, and it could be wrong, correct me, Dale or Beth, is that you don't want to laminate it before you get your second shot. If you're getting 2 shots, if you're part of that. But the key thing is to keep it safe. Someone suggested in the chat to take a photo of it, to keep it on your phone, which is, I've seen is a brilliant idea.
The reason that I heard not to laminate it is we may well be getting boosters.
Right.
So, we need to keep that card open for what else we might be putting in there at a later date. So.
Yep. And I think the other thing you can do simply is slip it in a little, snack baggie or something like that. Just a little.
Somebody recommended that. Let me see.
Those are inexpensive.
There are several online stores now selling vaccine card plastic covers rather than laminating, but it still protects the card. That was Tanya Daniels. Thank you, Tanya.
Right.
Yeah.
Yes, so whatever you want to do, but yeah, it is good to put it in something so it doesn't get shredded, because it's paper, plain old paper. So yeah.
And I think it might be good to read like Beth Barnett's question about how soon after having COVID.
Yeah, I was just going to circle back around to that. I wanted to finish up with the volunteer piece. And so Beth, thank you for sharing your story. It sounds like it was a positive experience that you were able to use your role as an advocate to help educate so that people understood, so they could make that real shared decision. It's that shared decision making model, right? Where you give them the information, and I think more times than not, when people really understand what the vaccine is about, that they're more willing to take it. Anything else you want to add to that, Beth, or to your experience, or what insight you had and working with?
No, it's just such a great experience, and people are so grateful for you being there. So it's just like a win-win. So
and Dale, so from your perspective, so we've heard the volunteers, from your perspective, what do you want to say about volunteering and why it's important that that everyone consider how they might be able to help?
Yeah, well, as Beth was saying, I think it's really important, a really critical thing, and I know a question came up about database. The Department of Health keeps records, CDC keeps records of the companies have the ability to notify if there's any concerns about your vaccine specific number. And so it's the paperwork that goes into recording this stuff is really important. And you don't have to be a computer whiz. You just need to be able to use a computer to help get that stuff entered. And like in Washington State, they look up they take your name, your birthday, and your vaccine record, and they'll even ask you, did you ever live at this address or something, to make sure they have the correct person. Wow. So you have that, you have pharmacy, you have so many safe checks in the way the vaccine's done. It's pretty amazing the high volume that can be done in a really efficient and complete way if you have enough volunteers.
Well, it's many hands make light work, right?
Yes,
it really is the community coming together.
And I volunteered in one of our community sites for some folks that had special needs, and we had volunteers from the community that were there helping. Really, really awesome to have community people when you go out in the community to make the participants who are getting the vaccinations feel more comfortable and to help them. But if you're not going to have that in a mass vaccination site, and so we've got all the people that Beth was talking about, escorts in and directing people to where to sit and wait their 15 minutes afterwards to make sure they're feeling okay. And there are always a provider who can respond if there's an emergency. There's always vaccinators there, but there's so many other people that serve roles of that as Beth so nicely put it, if you've got 2 hands and 2 feet, a brain's good too. Then if you're a human, there's a spot for you. So look in your own local community, look in your state. You can put in, vaccination volunteer in Google, and for your state, and things will pop up of how to access things. And then we will try to get some options on our website as well for folks to look at afterwards.
Right.
Really big, important thing. And then, when you do that, you understand, it's so rewarding to see people who've been waiting so long and feel just a sense of relief, even with that first shot, that finally they've got some protection.
Well, and I think about, you know, the
yeah.
people who are advocates go in this to
Yeah.
help people.
Yeah.
And really, this is a great way to help people. You know, it can seem like such a minor thing to be a smiling face, helping someone to find the right line or where they're supposed to sit. But really, you know, when you're scared, having that friendly face can be the motivator to do what you need to do or what you plan to do. So I think that I think you're right on with that.
Yeah.
I want to come back because Beth elevated something that I'd seen, and I think it's a great question. I want to talk about when, you know, we've said when you get offered, take the vaccine, whatever the vaccine, take it when you can get it and run with it. But what if you've had COVID? How long do you need to wait before you get vaccinated? You know, because remember earlier on people talking about people having antibodies. And so is there a best time period to get it, or what do you think, Dale?
Well, so we do know that the naturally acquired disease will give you antibodies to a certain degree. Sometimes people don't have detectable antibodies, but, you know, seem to be clinically protected. What we were saying initially, and I honestly do not know if this has been modified, is if you've had it, you know, at least 2 months ago. So the initial information we got from about vaccinations, about antibodies and how long they lasted, came from people who were donating blood that had a confirmed COVID case. And we saw quite a range of when the antibodies were present in the serum and when they were not. So probably waiting for 2 months is reasonable, just in case you're someone who uses up your antibodies sooner. And you know, doing it earlier than that, it's not clear that there's any complications from doing it. It's whether you're going to get the same immune response.
Yeah.
You may not, if you already have high circulating antibody, you may not get as much immune response. The one other thing that I should mention is that for other vaccinations, sometimes we have recommended pre-treating, and because with things like Tylenol or ibuprofen, and there has been a recommendation against that. Doesn't mean that you can't, if you get symptomatic after your vaccination, that you can't use those things. But pre-treating, some people are concerned, based on no data, just some people are concerned, since these were newer vaccinations, that we might minimize the amount of antibody response if we pre-treated. So just that is what's advised if you are looking around for your own vaccine. You could keep it handy for afterwards.
Go in and then take care of it if something,
if you need to. Yeah.
If you need to.
Yeah.
That's good to know. So the other thing I wanted to ask is, we sort of touched about it a little bit, but can we talk just a little bit about what we're seeing with, you know, school? We're about to come up to summer, but after summer is school season. And so what are the trends, or what are people thinking about with vaccinating adolescents and children? Are we seeing anything that we sort of should keep in our mind or as we go forward?
Yeah, I think there's been current research. I have not seen anything published yet. I tried looking for it yesterday in case there was something brand new with school-age kids. It is my understanding that the prior to school, that group of toddlers has not been looked at all. And the school-age kids, it's either age 5 or 6 on up, is probably the one we're waiting to hear about. The vaccines that we have out right now go down to age 16 and 18. So we have that sort of late teen covered. And so what the pediatric provider population really, before strongly advising or giving vaccinations, really wanted to see real data on school-aged kids, elementary, middle school. So I am expecting that to come out soon. And obviously that will make people feel better. Right now, back to school is a real thing. And there's a lot of discussion about hybrid, where there are certain days of the week that they go to school so that they can space out the number of kids that are in the classroom, and online learning versus all online versus all in class. And so you look at it both from the potential exposure,
Yes.
but you also need to look at it about the peer interactions that kids need. There's been a lot of really lot of anxiety in young kids that didn't exist before. We already know about increased risk of depression. There's been, increased domestic violence. There's been increased suicides. Yeah. So getting people back to that social situation is better, but there also is a concern that data, and I don't know how robust it is, that's out about the hybrid, which sounds like it might be a good solution, is apparently the worst for learning. Well, so yeah, damned if you do, damned if you don't, well, kind of
let's
thing.
Stick with this idea of data for just a minute, and younger populations, because we talked about the fact that earlier that we're seeing rises in cases for those younger people. So for those who are younger, and by younger, I mean like 18 to 65, is there any profile of who is more likely to get severely ill or hospitalized? Do we know any data around those who are skewing younger? Or who are younger and getting COVID?
With the younger folks, it's minimal. We know obesity is kind of an inflammatory situation. And obesity is a predictor of severe disease. So if a younger person happens to have obesity, that person would be more at risk for hospitalization and maybe even death. If they have other kids with asthma, I would be worried about those kids. Anybody with underlying lung disease, anybody with underlying kidney disease, and obviously diabetic, young people. So all of those are definitely risk factors for the younger population. But sometimes you'll find somebody that has none of that who gets severely ill. And we don't really understand that any better than, why women should get blood clots, So, so I think there's a lot more to be learned, and maybe it's genetic, and we, that's why we don't know, because they don't, our genes don't always show till we already, figure out we've got something. But the other populations are in terms of non-children risks, are basically the same sort of thing. If you have any kind of underlying illness, if you have obesity, and particularly if you have any kind of lung disease. So, a lot of people had asthma as a kid and have maybe a little bit reactive airways, but not ongoing asthma, but there's some lung stuff there. And we're seeing some more severe illness in that population. And again, the pregnancy population is another one where we're seeing some pretty sick women who are pregnant.
So I'm going to ask, we have time for just 2 quick questions. The first one is, I hopefully will be pretty quick, is around the percentage death rate in the US. Could you clarify what that percentage death rate is, please?
Yes. So it's about 1%. If you take whole populations, it's going to be higher in certain ethnic groups, and it's going to be higher in older age folks, and obviously, people with significant comorbidities, such as diabetes or, multiple things. So if you have, diabetes and hypertension together, things like that. You know, that we called out hypertensive disease to begin with, and in fact, it's if you have an underlying cardiovascular disease, yes, you probably are at higher risk for more severe and for death, even if you're younger. And I think it's unclear. That's one of the things that's really hard with the, say, 40-year-old population. Like, you know, why does anybody who's 40 die from COVID? That there may be some of that stuff, and they didn't know it.
Yeah. Undiagnosed.
So, yeah, that's really what it is. It's overall, it's about 1%.
And so, and I want to come back to this again, because we kind of touched on it, but I don't know that we directly answered it, you know, about the asymptomatic transmission by people who have been fully vaccinated. Is there no transmission? Is there some transmission? I know that we talked about, you know, continuing protective measures, but
we
do we have any information on that?
Right. We do not know. We know it's a possibility that you could have, because we know vaccines give us protection against severe illness in a really high percentage. We don't know what our risk is of picking up the virus if we're, say I've been fully vaccinated, I'm going everywhere, I'm not wearing a mask. You know, well, first of all, they won't even let me into the stores I want to be in, which I love. And so, you know, if I pick it up from somebody else, I may have nothing, or I might think it's seasonal allergies and still could pass it on to somebody who could get severely ill and die. And we've seen this single person, you know, these not just super spreader events, but some people that seem to have minimal disease themselves and, you know, infect 300 people. So some of the weddings and some of the things that we've seen where there's like one person that's the cedar. And so this is why I think we need to still be cautious for quite a while in making sure we don't infect other people. It's still, let me tell you, it makes you feel so good to think you're unlikely to get really severe disease if you do catch it. And that in and of itself, if we can hang on to that and not necessarily, you know, party on completely, then that's great. And it does allow us to do a lot more with our family members and with close friends and things like that. So again, the more people that get vaccinated, the better. And I think that this latest trend of increased illness and cases with the 65 and older not having it really speaks to how important it is to use vaccination for protecting those that are most at risk. And then just be cautious a little bit yourself. And I am more concerned about the variants that we may not have as good protectiveness for any illness, even though we still do have severity protection. So that would be my concern the most.
Well, I think what I'm hearing, and just to sort of wrap it up for everyone, is that we know a lot, we've come a long way, and there's still a lot that we need to learn. You know, we know that the vaccines are a great way to provide protection, but we still have the concern of the variants and maybe who can get the vaccine and when. We know that it's important for everyone to get vaccinated, and we also are still trying to figure out how we can get people get those shots into people, and that's why people should volunteer if they can. We know that we're seeing an increased rate, but it's not in the population that has been, and that's probably due to protective measures, but we're still learning. And I think one of the things that the pandemic has taught me is that learning, it reinforced, certainly learning is an ongoing process.
Yes.
And we will continue to learn more about this, and probably really won't understand it until much later. But as we continue to go through it, Dale, thank you for helping us understand where we can root knowledge, at least the knowledge that we have now,
Mhm.
and how we can act best on it and things we need to know. I want to thank Beth for not only sharing her story, but making sure that I saw some questions that were really important. I will say it's my first time trying to do this with the chat. And so I am really impressed by those people who do it well. And I want to thank everyone who tuned in today. I know it was sort of not your typical guest speaker, but it was really informative, at least to me. I didn't know that there was a CDC link tracking everything. So hopefully you came away understanding sort of how you can impact the community in a positive way through helping them track data, through helping them get people vaccinated, and through making sure that people understand that we're not out of the woods yet, but that doesn't mean we can't start doing small celebrations that recognize the sacrifices that we have made over the past year. Any final words from Beth or Dale before we close this out?
No,
We're
thank you,
1 minute
Dale.
over.
That was great. And we look forward to seeing you guys all. I think the next thing we have is a networking event. Ashley might be able to chime in on that, but we're always grateful to, and we love you attending our event. So we'll look forward to seeing you next one. And thanks, Bonnie. Good job.
Yeah.
So you'll don't forget, this will be posted, and check out HealthAdvocateX for more information and more events, including networking and learning opportunities. I'm just going to stay on screen for a little while so you can see my smiling face, the face of relief of having survived an hour, and everyone else have a great week.
Okay.
Take care.